One of the most important things in anatomy and physiology is being able to speak the language of anatomy. Like a lot of sciences, there's a lot of different terminology, different words that are new and unfamiliar to people, but the language of anatomy is important so that people always use the exact same terms and the exact same terminology for the things listed here: position, direction, regions, and structures. So there isn't much room for any confusion when when two people are collaborating and communicating about the human body. So to start out talking about the directional terms, first I want to say that these directional terms occur for the most part, except, well, one exception, they occur in pairs. And so for the reason they occur in pairs is kind of obvious, is because you can talk about two different directions with the human body. So the first pair refer to either moving toward the head region or away from the head region of a human being that is, of course, an anatomical position. And so superior means toward the head, and inferior means away from the head, or more like toward the feet. Superior and inferior are the two terms that we'll use mostly, as opposed to the other terms that are listed here in parentheses. We won't use those quite as much, but you might run across them in different references. This next pair, we will indeed kind of interchange these things. We'll use both ventral and anterior for meaning the front of the body, and we'll use both dorsal and posterior to mean toward the backside or behind. Each of those you'll see kind of 50-50 in different resources. With these three terms, the first two of them are probably more common, medial and lateral, but this one we do have a third one, which means in between, which is intermediate. But medial means toward the midline of the body, and the lateral means away from that midline. And here's something to bring up for these directional terms, is that they are also always relative for a particular structure. You don't see it pictured here, but perhaps you've heard of an MCL. That's a ligament as part of the knee joint, and that is the medial collateral ligament, as opposed to the LCL, which is the lateral collateral ligament. So the MCL, the medial collateral ligament, is that ligament that runs on the inner portion toward the midline of the body, the inner portion of the knee, and the LCL is at the outside of the knee joint. The kneecap, roughly, could be intermediate to those two ligaments. So intermediate means between between medial and between lateral. Like the bridge of your nose would be intermediate to your eyes. Proximal and distal, these are probably the two that cause the most confusion for students typically, and it's probably the easiest to remember that they're talking about extremities. In other words, they're just talking about the arms, or they're talking about the legs of a human. So proximal is toward either the shoulder joint or the hip joint, and distal is away from that joint at the hip or the shoulder. So anything that is on the arm or hands, or anything that is on the legs or the feet, you could use the terms proximal and distal when you're referencing those. For example, the elbow is proximal to the wrist, but the elbow is distal to the shoulder. So proximal, think of close proximity, and distal is distance or further away from the attachment point. Again, those two things, we're always talking about the arms and legs. So this pair of directional terms, superficial and deep. Superficial means at the body's surface, so the outside of the skin, or toward the outside. and deep is away from the surface or towards the inside. These two are also typically exchanged. They're not seen here on the screen, but superficial can be substituted with external, and deep can be substituted with internal. Next we have information or words that pertain to body planes and sections of the body, and these are again general terms, but sagittal is a term that describes a plane of the body that would divide it into left and right parts. Mid-sagittal is an equal, using the body or the organ's bilateral symmetry to talk about the midline of that organ or the body itself. So a mid-sagittal plane would go straight down through your eyes, through your nose, all the way down through your belly button, straight to the floor, and cut the body into equal right and left parts. Not all organs would have a mid-sagittal plane. Of course, if they don't show bilateral symmetry, there is no mid-sagittal plane. The frontal is the word that you'll see in our book and in most things, most sources, is separating it into front and back. So that's what I think of with frontal plane, but the correct terminology would be anterior and posterior, or ventral and dorsal parts. And a transverse plane, or a cross plane, but a transverse is the word that we'll use, is going to separate top and bottom parts, or correctly, superior and inferior parts. There's also oblique planes that our book doesn't use, but those would be used infrequently. But an oblique would just be essentially a diagonal plane through the body. So here's examples of those planes that we were just talking about, pictures to show you the difference between them. In A, all mid-sagittal planes are sagittal planes. They separate into right and left sides. It wouldn't have to be on the median or the midline of the body to be just a sagittal plane. B is frontal, front and back, and transverse is superior and inferior sections of the body. And you can also see these different types of imaging scans that show those types of planes as well. And these, with different types of imaging techniques, whether they are CAT scans or they are even X-rays or CT scans or MRIs, those are where these body planes would be referenced most often. And lastly here, just to define the general body cavities in the human body, we've got first dorsal and ventral, and then each of those are broken down into specific cavities within those general cavities. So dorsal, again, you know what that means as a directional standpoint, but that only includes the cranial cavity where your brain would be found and the spinal cavity where your spinal cord is. Both of those are cavities that are enclosed, as well as the ventral cavity being broken down into thoracic cavity, which is essentially everything you would find underneath your or deep to your thoracic cage or your ribs, and abdominal pelvic cavity, which is essentially all the organs that are inferior to the diaphragm, which is the muscle that helps you breathe, that is just below your lungs and separates your lungs from, say, your stomach and your intestines in your abdominal pelvic cavity. So of the cavities that we just talked about, you can see that marked in yellow here would be your dorsal cavities, and marked in red here would be the ventral cavities. And again, notice that this structure, the diaphragm, is a physical structure. The separation between the abdominal cavity and your pelvic cavity, there really isn't a physical structure there. It's just that reproductive organs are in the pelvic cavity, and for the most part, digestive and other visceral organs are found in your abdominal cavity.